Welcome to The Big Unlock, where we discuss data, analytics, and emerging technologies in healthcare. Here's some of the most innovative thinkers in healthcare information technology talk about the digital transformation of healthcare and how they are driving change in their organizations.
Hello, everyone. This is Paddy, and welcome back to our podcast. It is my privilege and my honor to have as our special guest today Dr. Albert Chan, Chief Digital Officer of Sutter Health. Dr. Chan, welcome to the show.
Thank you very much. I'm excited to be with you today.
Very good, very good. So, Dr. Chan, before we get started, for the benefit of some of our listeners who may not know who Sutter Health is, do you want to just take 30 seconds to provide a quick introduction to Sutter Health?
Sure. Sutter Health is a large integrated delivery network in Northern California. We have 24 hospitals, several hundred clinics, and we have a great team of 12,000 physicians and over 55,000 employees who work together to care for almost 3 million patients on an annual basis.
And you have a special relationship with Sutter Health, right? You and your children. Do you want to just briefly touch on that?
Sure. So I firmly believe in Sutter Health and want to see it do well, and mostly because Sutter Health is responsible for taking care of my entire family. In fact, I like to say I was born to work at Sutter Health because indeed I was born at Sutter Health in 1972. And to this day, our family receives care at Sutter. There's nothing like really being invested in a health system to make sure we innovate and make the care available to our patients, including my family, the best that it can be.
That's wonderful. That's wonderful. So, Dr. Chan, you are the Chief Digital Officer of Health. So can you tell us, what does digital mean to you and to Sutter Health? What does the role mean? What is your mandate?
So my mandate is really the intersection of two domains, the intersection of digital health and how it can improve the lives of our patients to Office of Patient Experience. So combining digital health with patient experience, try to improve outcomes for our patients is the mandate that I have from the organization, and I take that responsibility very seriously and look for opportunities for us to think digitally, to think about new ways to reduce friction for our patients. That's probably the most important thing we can do so that we improve access to care.
So is it fair to say that the primary focus of the digital transformation program at Sutter Health is really about enhancing and improving the patient experience?
Absolutely. It's not digital just for digital's sake, if you will. It's really looking for opportunities to enhance the experience for our patients, and that happens to take advantage of digital transformation and the opportunities that technology can play, improving the lives of our patients. So that's our primary focus. And the projects we take on really are centered around that. Yeah.
Right. And we've met and talked about some of the work that you're doing and some of the early successes that you've had. Do you want to share a few vignettes of some of the things that you've done that have made a tangible impact to your patient experience and also to the health system? Can you talk a little bit about some of your successes, your wins, if you will?
Thank you for your kind words. We can start off by, Sutter has made a tremendous commitment to innovation and digital transformation over many years. In fact, we're, I believe, the first in the country to actually launch MyChart for our patients. Our first patient on MyChart, our patient portal, we actually call it My Health Online. Our first patient was launched in January 2001. So we've been long proponents of empowering our patients with digital technology. And I venture to say we were one of the first in the country to empower patients with their own health information to make a better informed patient.
Right. And for the benefit of listeners who may not know, MyChart is an Epic feature and functionality that's primarily to do with managing patient interactions. Is that correct?
That is correct. What I like to say is it's really an extension of the care experience. I'm a firm believer in shared decision making. That is to say, the doctors and the patients partner together to improve the health of patients and families. And technologies like MyChart really help with that. You can imagine the patient being much more empowered, having access to their own records, their own data, their laboratory results, and how that enriches the experience and the conversations you can have between doctor and patient.
Right. Now, you touched upon the doctor and the interaction between the doctor and the patient. And lately, there's been a lot of discussion around the burden on caregivers, doctors in particular, partly due to work overload. Some people say it's fatigue from a lot of the electronic health record systems and the work that they need to do on top of caring for patients in order to meet compliance needs or just documentation needs or whatever. So, how do you address that? Is either in your role or as Sutter Health, how do you really look after caregivers as well in order to enable a better patient experience? Ultimately, it's going to translate in some way to the patient experience, correct?
Yes. So I'm a firm believer in the quadruple aim, which is, as defined by the IHI and others, really an initiative to say, how can we improve patient care and take into account the interests of the physicians or the providers? Because to me, it is truly in that intersection, that partnership, where we can achieve the beneficial outcomes we want for our families. Ignoring one part of the ecosystem is a problem, and we are firmly committed to taking care of both our patients and our providers to create a better health care system for all of us. I will say this: there has always been administrative tasks and duties in medicine, for sure, and electronic health records and other tools like them enable us to do many more things that we couldn't otherwise do. For example, historically, if you order a laboratory test for a patient and you gave them a lab requisition, it was on a piece of paper. So if they didn't fulfill that requisition, that was the end of the story, right? But now, with the power of the electronic health record, you can track these things. You can get reminded about these things, but that obviously creates new workflows, new things for us to account for as we take care of patients. And I think that's some of the source of some of the frustration, namely, have we optimized the workflows that can achieve those benefits, but also taking into account the needs of our providers who are providing that care for patients.
Yeah, I think that is well said. And people tend to forget that there was always a documentation aspect of a caregiver's job. It's just that it used to be on paper. Now it's become electronic, and possibly some parts of it have become or feel a little bit more burdensome than was expected. But it was always a part of the job, is really what you're saying, right? To document it.
Absolutely. Yeah, and actually, I'd like to point to some work that my friend Chris and colleague Chris Longhurst and Lance Downing have just published in the Annals of Internal Medicine that talk about, in fact, a comparison of if you will, the chart documentation length in other countries versus ourselves, and there's a stark difference there. So it's easy to say that it's because of the electronic health record that folks are having symptoms of burnout or other things. I think that there's much more nuance to this issue, and really we have to think more broadly about how we can solve this challenge for our docs and our other clinicians.
Right, and you're a physician yourself, so does that help you in some ways to have, let's say, more empathy and appreciation for the role of a caregiver in this whole care continuum, especially as it relates to really understanding the workflows and then optimizing all of that while at the same time using the technology for the benefit of improving the patient experience. Talk to us a little bit about how you bring the sensibilities that you have gained through your training as a physician to your job?
Well, it's not just empathy. I'm actually a practicing clinician, so I do that because I love the practice of medicine, and also keeps me grounded in some of the challenges my colleagues face when, navigating this thing we call healthcare. I acutely feel the opportunities to take care of patients in these new digital ways, and yet understand that there are lots of workflow implications, lots of things we need to take into account as we deliver these technologies for both patients and providers. Our own research, for example, that appeared in Health Affairs talked about our efforts to try to understand this challenge. We noted in our publication that for every 3.08 hours spent face-to-face with patients, our providers were spending 3.17 hours on what we call desktop medicine. And let me just be clear about this. It's not just an administrative task. Desktop medicine includes things that are really care opportunities, answering emails from patients, reviewing lab results of patients, answering refill requests, so forth. So those are all clinical care opportunities and clinical care transactions that need to be accounted for in the digital age. But that does obviously present some workflow challenges that we need to address. That is the new work, if you will, that is made possible by digital technology, and we have to account for that and figure out the best ways to optimize for that. In our own institution at Sutter Health, we've made a tremendous commitment to our providers. For example, many of your readers may know about the Meaningful Use program that incentivizes care practices to launch electronic health records. As part of that program, we realized the incentives that many other health systems did, but we pledged to take those incentives and actually apply them back to optimization programs for our physicians. That was key to, in other words, if you go to medical school, you learn to use a stethoscope, you learn to diagnose things for patients. In this day and age, one of the things that you need to be really skillful at is actually how to use electronic health record appropriately. And so we really pledged and invested in programs to teach our clinicians how to use these tools effectively.
Right. And so that it's a nice segue into what I was also going to explore with you, which is the role of emerging technology, especially in the context of digital transformation. So we all know that we spent the better part of the last decade putting in the electronic health record systems and digitizing medical records. But that's just the foundation. Now we are trying to build engaging experiences, and in your role as Chief Digital Officer, that's a big part of what you're trying to accomplish. So what are some of the emerging technologies that you're seeing, and how are you working with them to complement and build on top of the foundation that you already have, which is your electronic health record system? Where do you see some of the big opportunities, especially as it relates to technology-enabled, enhancement of the patient experience?
So that's a great question. I'd like to just step back for 1 second and talk about electronic health records. They're very powerful tools. For example, if we want to take care of a population of people, and for example, say this population of patients needs reminders about healthcare maintenance, or in other words, preventive disease reminders or chronic disease markers that we should be tracking. That is really truly made possible by electronic health records. Now, to achieve those benefits, we need to take advantage of other digital empowerment tools that can help manage the workflow, the new workflows, the new workload that comes from that platform. And in other words, if we provide the tools to truly take advantage of the technology, that's paramount to me. And we really at Sutter Health have explored how we can do that to empower our physicians, for example, to be able to leverage the data that is in the EHR. I'll give you an example. There is a risk of turning doctors into typists. That is one of the risks. As you said earlier, Paddy, we've always had this documentation need, but there is the opportunity in the electronic health record to say, let's make the doctor the typist. Well, one of the things we've done is leverage emerging technologies, namely Google Glass, to try to empower our physicians and other clinicians to not have to be burdened with chart documentation. That is to say, if we can provide virtual assistants to take on that task, they can focus on engaging with the patients. In our experience, we have over 100 doctors now in the service, and we've had this experience where connecting a doctor to a virtual scribe overseas enables the doctor to focus more on the patient, to maintain eye contact with the patient, and take their hands off the keyboard, if you will. And in that moment where you're connecting with the doctor and the patient, you can really have those magical moments where you can take care of people, connect with people, the way we all wanted to do is when we went into medical school.
That is a great example. I think Google Glass is, of course, a great example. Are you, I'm just curious, are you using voice-enabled digital assistants? I'm not necessarily talking about an overseas scribe, but are you using voice in any other way? Are you exploring any of that in order to reduce the burden on caregivers, whether it's doctors or nurses or whoever?
Well, one of the areas that I think I would like to highlight, back to your point about patient experience, is really empowering the patients. So one of the things we're doing with voice assistants is actually trying to take the navigation out of health systems and try to improve that experience. So we've actually used the Amazon Alexa platform and Facebook Messenger, and soon to be releasing a Google Home functionality that allows patients to navigate our health system. That is to say, we know that today what we ask people to do is either dial on the phone or try to navigate a website. What if you had an intelligent assistant help you navigate your choices for care? What if the assistant could say, for example, find me the nearest urgent care? Now, today you could Google search that, MapQuest it, etc. But what if the digital assistant could say, hey, the nearest urgent care to Patty is 123 Main Street, and the wait time is 2 hours? Oh, but by the way, Patty, because we're empowered by a digital assistant, the digital assistant could say, hey, I noticed there's another urgent care 15 minutes away where the wait time is only half an hour. Would you like to choose that one instead? That to me is sort of some practical implementation of AI that's very achievable today, and those are some of the tools we're releasing for our patients today.
That's fantastic, Dr. Chan. I think you touched upon the next topic that I was going to talk to you about, which is the use of AI. You kind of led into that. So the use of all these new technologies, voice-enabled assistants and so on, supported by AI tools, and eventually integrating in a seamless way with your system of record, which is your electronic health record system. That is kind of your holy grail, right? I mean, you can create multiple experiences that kind of replicate the same formula, but in different scenarios. And as as these technologies get more and more accepted, then you get more and more adoption, and you're able to move the needle in terms of not just enhancing the patient experience, but also reducing the burden on clinicians and caregivers and enabling them to spend more time with it. So it's a double benefit. So that's. You agree with that? Does it resonate with you in terms of how the future looks?
Absolutely. So I'm a big fan of the movie Top Gun. And in Top Gun, there was you had a wingman, right? So you can imagine our vision of this is you have a digital wingman that helps you anticipate your needs, helps you reduce friction to navigate the things that you need to navigate. That's what we're hoping to build, both for providers and patients, and that's sort of our overarching vision for some of the initiatives we take on. Because after all, everyone needs a wingman, and it's nice to have the support of your health system to do that.
Digital wingman. I have not heard that one before, so that is just that is going to stick with me. I love that.
Well, thank you. Well, there's a debate in our health system if I'm Maverick or Goose. I'm not sure yet, but we do like the digital wingman concept. Yes.
Fantastic. So a couple of other questions to round out this conversation. I know we can talk about this for hours, and this has just been absolutely fantastic and really eye-opening in terms of how you're approaching your role and digital transformation in general. So, let's talk a little bit at a broader level. What do you see other health systems focusing on? Is everyone pretty much focusing on this patient interface and trying to enhance? Is that kind of like the top priority for everyone? What are some of the other things that others, your peers across the industry are working on? Where do you see the big focus?
Well, I think all of us are really trying to figure out how to, what to digitize, what to enable. I think we all share a common vision, right? All of us want to deliver health care more affordably in a much more personalized, friendly, efficient fashion. I think that's true for all of us, whether it's my health system or others. I think the range of solutions that we approach range from very simple things that really touch patients each and every day. So, for example, we have really made a big focus of in allowing patients to be able to schedule their own appointments online. That's been a huge area of focus because we believe that helps. It's a win-win for both parties. It engages the patients, allows them to really honor their time and allow them to select the times that make sense for them. And obviously, also the opportunity for us to have cost efficiency for having patients take care of that for us instead of using call center staff. And if we can do that effectively, if we can figure out ways to do that in an efficient manner, then we can leverage those resources to answer other clinical needs, other nursing needs, or other physician needs, for example. So that from that one end of the spectrum, engaging patients that way, up to I think, the Holy Grail, as you sort of mentioned that concept, I think there are lots of opportunities for predictive analytics. Imagine being able to predict the health of a population and identify early on what are some of the impact factors that you can affect as a health system to avoid disease. That to me, that's in that continuum, we have tremendous opportunity to change the outcomes of our patients if we really address both fronts, both the transactional needs of our patients up to the really truly transformative things that we could do to improve the health of the country.
That's awesome. Well, Dr. Chan, we can't not talk about some of the challenges that you may face in trying to navigate through this transformation. So, what have been some of the big challenges in your view as you implement these programs? What are the top 2 or 3 that you consider as the challenges to be overcome for anyone in your kind of a role?
Well, I think with any type of change, digital or not, change management is key. We have to be sensitive to the needs of folks who are in the trenches taking care of our patients, understand their workflow needs. And so change management and being sensitive to those needs is truly, truly paramount for us to achieve long-lasting benefits from digital transformation. So it is not as simple as just turning on a switch. It's really understanding workflow needs, understanding cultural needs, understanding the resources that are required to really affect change that will really lead to lasting change for our health systems. And I think that's each and every day. That's something I think about as we launch new initiatives or really try to optimize existing ones. I can't emphasize enough the need for that. I would also say also cultural and governmental and other norms that exist today will have to morph, have to change as technology improves. Technology empowers us to do new things. Our legislation and our cultural norms will have to change and adapt to be able to understand that, to realize that benefit. Because I think it is an intersection between both tech and cultural understanding that really you get that benefit. But if you don't take care of both sides of that equation, then you won't really achieve the benefits you hope to achieve.
Right. That's well said. Well, as a final thought, what is the one kind of learning or recommendation or advice that you would give to your peers in the industry who are in similar roles? And what is the one thought you would have for technology partners who are, as you've pointed out, an important part of enabling you to navigate through the digital transformation for Sutter Health? What would be your one thought for each of these stakeholder groups?
So I think the most important skill that I have is the ability to listen. Just like when we're caring for patients, it's almost always in the history of the patient that the patient tells you as you have the office visit encounter or the encounter in the hospital. History and listening to the patient is everything. Similar to that, we listen to all of our stakeholders and really take the time to engage all of our stakeholders and listen to what they tell you, because the answer lies within what they say. As they say in the musical Hamilton, so say less, listen more, I think is the phrase. That's to me the key. If you can really listen and more importantly, hear. So it's not just listening for listening's sake, but to actually hear what people say. The answer is there. And if we can work together in partnership, that's usually where we get the benefit. So that'd be my advice to anyone who's trying to take on these sorts of changes. It's really focusing on learning how to listen and hear.
Well, that's great. Unfortunately, I have not had a chance to see Hamilton, but it is on my wish list, and I hope to make that happen soon. But it's been wonderful talking to you, Dr. Chen, and thank you so much for sharing your thoughts and your insights, and all the very best with your role and with the digital transformation. We'll be in touch.
Thank you, Paddy. Thanks for the invitation today.
Thank you very much.
We hope you enjoyed this podcast. Subscribe to our podcast series at www.thebigunlock.com and write to us at info@thebigunlock.com.